Southeast Radio's Business Matters with Karl Fitzpatrick.
Southeast Radio.
Well, the month of January can often act as a trigger for people who are looking to lose weight. But with calorie intake no longer seen as the metric for effective weight loss, people are now looking for a different approach to weight management. Dr. Harriet Treacy has developed Beyondbmi, and she joins us now to discuss her innovative approach to weight loss. Harriet, before we look at Beyondbmi, I'd like to get an insight into your own background.
Oh, thanks a million, Karl. Really looking forward to chatting. So my background is I'm a medical doctor. I have been practicing for just short of 10 years now. I qualified from the University of Nottingham back in 2013 and spent a bit of time working in the NHS across quite a different selection of specialities, including surgery, respiratory medicine, and then a little stint in general practice. After that, I went to Australia for a couple of years, and I suppose the whole time, Karl, there was a growing sensation within me that I felt there was something else we could be doing within healthcare. I was particularly interested in I suppose, the system-based approach to healthcare and how models were changing. And that was really what led me to come home to Ireland and enrol in a master's.
So what is a systems-based approach to healthcare?
So I suppose, when we look at healthcare, a lot of the time we see that there are individual offerings. There are very transactional, siloed healthcare offerings. And I think when you start to look at models like, for example, value-based healthcare, which is a model that's really taken off in the United States, we can see that value-based healthcare is about aligning all of the financial incentives across all the different stakeholders. And as a result, there is more of an incentive to keep people well.
One of the areas that I do want to speak to you about this morning is obesity. As a doctor, how prevalent is obesity in Ireland today?
So obesity currently affects almost 1 in 3 people. And if we take into account overweight, which is a BMI between 25 and 30, you're talking about actually 2/3 of the population. So really, that's a huge number of people when you think about it. And it's not just Ireland, it's across the Western world, and it's becoming increasingly prevalent in pretty much every continent in the world.
And what are the health risks associated with excess fat? And are people here in Ireland actually aware of all of the potential issues associated with it?
Well, there are almost 220 complications associated with the disease of obesity. Now, that is some of the highest number of complications of any other disease. So what that really means is that excess fat and the accumulation of excess fat carries a number of risks for other health conditions. And these can be everything from type 2 diabetes, cardiovascular disease, so things like, for example, stroke and heart attacks, right the way through to dementia, osteoarthritis, and also quite a few different cancers as well. Really there's a huge risk associated with excess fat. To answer your second question, are people aware of it? I don't think they are. I think that for too long, obesity has actually been viewed as an aesthetic issue, more of a, and I want to get bikini body ready, I want to look well. It hasn't had the right emphasis put on the health implications of excess fat. And I think that's been a huge disservice to the general public, because it means people are not addressing their weight for the right reasons sometimes. They're not thinking about it in terms of, wow, I really need to improve my health. They're thinking more about it in terms of, I want to get bikini body ready, or I want to be skinny walking down the aisle. And I don't always think that's people's fault. I think it's a huge amount to do with social media and a huge amount to do with the general marketing that we receive on a daily basis about, what it means, the societal expectation to look a certain way and to be a certain way. So I think it's a very, very difficult environment for people to be in, trying to understand weight and its association with health.
And what, in your opinion, needs to be done to change this ingrained mindset?
I think we need to see more experts in the field of obesity being given access to educating people, being given access to spreading really well-informed, expert-led advice around this. I think if you look across all the media channels, you've got all different types of people talking about weight and you know, the issues around weight. But I think you'll see that less than 5% of them have any kind of expertise in this area. Like, you know, you're not talking, you know, they're not dietitians, they're not, you know, scientists, they're not doctors specialising in obesity. So I think we need to give a bit more airtime to, you know, to people who are actually specialising in this area, so that we can actually give people access to better curated information.
I was listening to a very interesting interview with Dr. Tim Spector recently, and he claimed that calorie counting to achieve weight loss is a deeply flawed approach. What are your thoughts on that?
I think the science of obesity has evolved. I think the message around the science of obesity getting out into the public domain has been very slow. I think scientists have known for a very, very long time that obesity is far more complex than simply calories in and calories out. But it's only in recent years where we've seen the emergence of new treatments which are very much based around the science of obesity, such as, for example, semaglutide, liraglutide, or any of these new medications, that really the conversation is shifting to obesity as a disease and the complexity of this disease. And, you know, I heard a really, really great analogy recently by a physiotherapist who talked about the difference between a closed loop system and a complex system. And if you think about, Karl, for example, putting fuel into your car, it's a pretty simple equation. You know, the amount of unleaded or diesel you put in your car will have a very direct relationship to how many miles you can get with that fuel. So it's kind of, that's the analogy of calories in, calories out, very simple. But unfortunately, our bodies don't work in that way. Our bodies are not as simply designed as a car. They have multiple systems. We have the lymphatic system, the cardiovascular system. We have, you know, the hormonal system. You know, it's the endocrine system, as it's known in medicine. And so our bodies don't work in that same closed loop system. And so therefore, you can't just simply say metabolism is a function of calories in, calories out. There are so many different processes happening in the body that influence it. And we know this now because the science is telling us how strongly associated our gut and our brain are, and how it's actually the brain that controls appetite.
So talk to us about your 12-month weight loss programme and how it differs from traditional weight loss programmes.
I think the predominant differentiator for us is that we are medically led. So unlike some of the typical commercial weight loss programs, which are very much based in the rhetoric of eat less and move more, we have a team of medical professionals. And by medical professionals, I mean not just doctors. I mean health coaches. I mean nurses. I mean dietitians. And we all come together in a multidisciplinary team. And over the course of the 12-month program, we give people access to doctors who are able to diagnose and create the right treatment plan alongside patients, so personalise it to them. We have dietitians who are able to help people to make sure that when they are losing weight, they're losing it in a healthy way, that they're not ending up with macronutrient deficiencies, such as, for example, having a low protein intake, which can lead to issues such as sarcopenia, which is essentially where you have very low muscle mass, and that can be a condition in and of itself. We make sure they don't end up with micronutrient deficiencies, such as, for example, iron deficiency anemia or B12 deficiency. All of these things can be very much associated with weight loss that's not done effectively. And so by having access to a team of experts, you can be kind of rest assured that people are looking after not just your weight, but also helping you to gain health as you lose weight. And I think that has to be an important conversation. We cannot talk about weight loss without talking about health gain.
So, Harriet, in terms of your route to market, is it your plan, similarly to what happens in the US market through value-based healthcare, to partner with health insurance companies here?
Absolutely. I mean, we're in conversations with a few different health insurance companies at the moment, and you know, I'm really excited about where that relationship is going to lead. I think, you know, when I speak to some of the insurance companies, they're very much aware that obesity is an issue. I think they're still trying to wrap their heads around how strongly obesity is associated with other healthcare conditions. I think they're seeing a rise in the number of people looking for bariatric surgery, and that's going to become a financial issue for them down the road as well. And so I think really there is only one way that they're going to be able to offer value to their clients and offer value to people living with obesity, and that is to partner with the likes of Beyondbmi or really any kind of medically based approach. So look, I see it as a synergy. I see it as a partnership. I think we're both after the same objective, which is to improve people's health. And I think insurance companies are going to play a huge part in that.
Finally, Harriet, what are your long-term growth plans for Beyondbmi?
So we're looking at different geographies at the moment, and we're looking at different routes into those geographies. I think, as we said at the start here, obesity is not just a problem for Ireland or even just the UK. This is a global problem. And I think, there really is a great opportunity for us to look at different markets. I'm pretty interested by what's happening in Europe at the moment. So I could potentially see us moving into some of those English-speaking countries, in the next sort of 6 to 12 months. But I think ultimately, we are looking to grow beyond Ireland. Like, Ireland's been a great place to start our business, and we're learning an awful lot. But I think there's a huge opportunity for us overseas.
Well, if you've just tuned in, that was Dr. Harriet Treacy from Beyondbmi, and I'd like to thank Harriet for joining us on this morning's show.
Southeast Radio's Business Matters with Karl Fitzpatrick.
Southeast